Hello everyone, we're the small group discussion of B7. Now we will present you our student project entitled Electroconvulsive Therapy or ECT. Here are our members of the group.
Hello everyone, my name is Audrey with the last 3 digit of student number is 142. So electroconvulsive therapy or ECT developed over 8 years ago effectively treats severe depression with controlled brain stimulation, usually 8 until 12 sessions under anesthesia. Endorsed by the UK's National Institute for Health and Care Excellence and classified safe and effective by the FDA for severe depression and catatonia in 2018. ECT has global recognition with around 1.4 million annual recipients, primarily for treatment-resistant depression. Despite misconception, economic analysis proposed ECT consideration earlier in treatment, potentially after just 2 failed antidepressant or psychotherapy trials, challenging traditional practices.
I will continue the presentations. My name is Ayu Prewerti Nia Surya with the last 3 digit student number 230. So, for the problem identifications, we would like to formulate a series of research questions such as what is the overview of ECT, what is the history of ECT, what is the perspective of ECT through anatomy and physiology, what are the indications and contraindications to ECT, what is the equipment of ECT, how effective is ECT in therapy, what are the complications of ECT in therapy, and for the purpose, we want to accomplish the following objectives such as explain the overview of ECT, explain the history of ECT, describe the perspective of ECT through anatomy and physiology, explain the indications and contraindications of ECT, explain the equipment of ECT, describe the effectiveness of ECT in therapy, explain the complications of ECT in therapy. And for the significance of reviewing studies regarding ECT is to determine the effectiveness of electrocurrent therapy in patients. Therefore, we expect this article to help increase the recovery rate and quality of life of patients. Thank you.
My name is Putu Cahya Prameswari with the last 3 digits of my student's number are 151. I will explain about the overview of electroconvulsive therapy. Electroconvulsive therapy is a procedure that uses a device that delivers electrical stimulation to electrodes, causing a generalized seizure. This therapeutic action is administered under general anesthesia and muscle relaxants to minimize discomfort. The flow of electric shocks produced through this therapy can affect the chemical structure in the brain. That reversing symptoms associated with severe mental disorders include major depression, chronic depression, mania, catatonia, and certain neuropsychiatric disorders. In addition, this therapy is considered a second or third line that is usually used when medication and psychotherapy have failed.
Thank you for the opportunity. My name is Chintya with 3 last digit of student ID is 018. So now I will present about the history of ECT. ECT is one of the oldest treatment methods in the field of psychiatry that was developed 8 years ago. This method initially formed as a result of the hypothesis that there are antagonism between epilepsy and schizophrenia that was proposed by Ladislas J. Meduna. In 1934, Meduna used intramuscular injection of camphor then cortisol to induce seizures in patients. This is effective but not efficient because seizures occur a few minutes after the drug is injected, and during that time, patient suffers from sympathetic overdrive and a deep sense of terror. That made Hugo Carletti and Lucio Bini look for alternative ways to induce seizures with a faster onset and fewer side effects. They finally conduct electrical current on the skull by applying 110-volt alternating current for 0.2 seconds, and then they success in causing a seizures and weakening the patient psychosis. After this, ECT continued to improve, like shortness the duration of stimulus and modified with anesthesia. Until now, ECT has still provide benefit in the treatment of psychotic disorder. That's all for me. It will continue by my friend. Thank you.
My name is Gede with 3 last digits student registration number of 100. ECT through anatomy perspective. Hippocampus. Patients receiving ECT have consistently shown increased volume of the hippocampus and other regions, correlating with reports of decreased hippocampal volume in depression during magnetic resonance imaging investigation. Perimeter. The basal ganglia, temporal, insula, and anterior cingulate cortex are only a few of the brain areas where ACT-related alterations in gray matter volume or density have been found. White matter. ECT may also affect the integrity of the white matter, presumably due to increased blood-brain barrier permeability, impairing fiber transmission. Additionally, baseline diffusion measurements and therapeutic response were linked. A generalized seizure may need coherent fiber structure, and increasing seizure activity may be successfully inhibited by inhibitory brain transmission.
Hello everyone, my name is Joanna with the last three digits of my student number 079. This time I'm going to explain about the ECT through physiology perspective. So there are so many theories out there that have been put out about the physiological mechanism of ECT. According to one theory, ECT's therapeutic effects are explained by how it affects neurotransmitters, notably the serotonin, dopamine, and gamma aminobutyric acid or GABA systems. Another theory views depression as a pro-inflammatory condition that can be treated with ECT by targeting cytokines. ECT has also been shown to enhance the release of hormones involved in the HPA axis. Numerous studies have also supported the modification of epigenetic as one of the mechanisms of ECT as well. It appears that the most promising hypothesis behind the mechanism of ECT is ECT-induced changes in structural brain plasticity. This is potentially caused by the increasing quantities of neurotrophins, specifically brain-derived neurotrophic factor or BDNF, a crucial regulator of neuronal function, which leads to beneficial cellular changes of the brain, such as neurogenesis, dendritogenesis, and synapse formation. That is all from me. The next will be continued by my dear friend. Thank you.
Hello, my name is Adam Zulfikar. With my last three-digit number is 166. So I'm going to do a presentation about the equipments for electroconvulsive therapy. So electroconvulsive therapy requires a device that can induce a constant electric current. The current strength that is kept constant is usually in the interval 0.5 until 0.9 amperes. Physiological parameters including the electroencephalogram, ECG, and blood oxygen levels may typically be monitored by modern devices. But when receiving therapy, additional tools such as a stethoscope, blood pressure monitor, electrocardiography, oximeter, suction device, and oxygen delivery system must also be present during the therapy.
Hello, my name is Putu Ari Apsari with the last three digits of my student number are 058. I will continue the presentation to explain about indication of ECT or electroconvulsive therapy. ECT is an effective treatment for depressive stupor and inanition, as in melancholic, catatonic, or psychotic depression. It also can be used to treat schizophrenia accompanied by extreme depression, mania, and other affective components. ECT has also been shown to have excellent effectiveness in geriatric patients. Response rates were better in younger than in older geriatric patients. That's all from me. Thank you.
Hello everyone, my name is Mahadewi with the last three digit number 189. In here I explain about contraindication of ECT. One of the most significant contraindication of ECT is the presence of certain medical condition that may put the patient at increased risk. These include recent heart attacks, severe cardiovascular disease, and uncontrolled hypertension. Additionally, ECT may not be recommended for individuals with certain neurological conditions, such as brain tumors or recent head injuries. ECT is also generally avoided during pregnancy, especially during the first trimester, due to the concern about potential risk to the developing fetus, and there are no absolute contraindication, only relative contraindication to ACT. Overall, this decision of undergoes ACT should be carefully considered in consultation with a qualified healthcare professional who can weigh the potential benefit against the contraindication and individual patient factors. Thank you, and continue to my friends.
Hello everyone, my name is Putri Balqis Khanza with the last three digits numbers 136. Right now I'm going to explain about ECT's therapeutic effectiveness. ECT is considered as a therapy that is relatively safe and recommended to treat some mental disorders such as treatment-resistant depression or severe depression, bipolar disorder, and schizophrenia. For depression, ECT has a greater antidepressant impact than other pharmaceutical medications such as SSRIs, tricyclic antidepressants, and monoamine oxidase inhibitors. ECT is also known to alter brain chemistry, which can improve the symptoms of severe depression. Then for the patients with bipolar disorder, especially for geriatric patients, ECT can help to avoid the interaction between lithium and other geriatric drugs, whose interaction can cause tremors. Next, ECT is also recommended for schizophrenia patients who do not react well to traditional antipsychotic drug treatment like clozapine.
Hello, my name is Natasya with real student number 111. Besides the advantages, ECT causes some complication. It causes cognitive impairment such as confusion, delirium, disorientation, and memory loss. Cardiovascular disease may also occur, such as bradyarrhythmia, asystole, tachycardia, hypertension, increased cardiac troponin level, and myocardial ischemia or infection. Cerebral blood flow and intracranial pressure may increase and cause cerebral hemorrhage or stroke. Besides that, pulmonary disease may also occur.
I'm Muhamad Hudaya with 3 last digit student register number 093. The conclusion is ECT is the oldest method which from hypothesis of antagonism between epilepsy and schizophrenia that developed to be more efficient and safe for severe psychotic disorder by affecting chemical structure of the brain with electrode stimulation under general anesthesia and muscle relaxation. Both anatomy and physiology show that ECT affects several neurotransmitter, neuroendocrine, as well as stimulating neurogenesis, brain plasticity, and epigenetic change, which contribute to the cure of the depression. ECT device is kept on a constant state so that it still have biological effect without injuring the local tissue. Therefore, this therapy are not recommended for the patient who has neurological condition such as epilepsy and during the first trimester of pregnancy. ECT can have adverse health effects related to electrical stress and seizure such as hypertension, tachycardia, increase the cerebral blood flow and intracranial pressure, also cognitive impairment. This is the end of our presentation. Thank you for the attention.